Thank you for joining us for the Royal Table Talk series Cold Blue, Reducing Black Mortality in Childbirth live event. We bring to you now our moderator for today, Sora Brooke Walker, a member of Theta Epsilon Sigma Alumnae chapter in Culver City, California. Welcome to our program.
Thank you for joining us. As stated, this is our Project Cradle Care series. We'll be talking about reducing Black mortality in childcare. A little bit about Project Cradle Care was started by Sigma Gamma Rho in partnership with March of Dimes to focus on providing health education, support, and nurturing for expectant teen mothers and teens who are parents. The goal is to provide information about issues related to prenatal and postnatal care. Participants will also be able to obtain information about birth defects, sudden infant death syndrome, basic baby care, and so much more. And again, our topic tonight is reducing Black mortality in prenatal care, and just some of the factors involved, and some of the things that professionals are doing. So tonight we have two experts that we've asked to join us, Angela Ramsey and Alexis Small. And before we kind of get into the discussion, there's a short video that we'd like you to see about maternal health care in women of color. So take a look.
He's the one who noticed his mom's face was swollen. They're the ones she confided in about her change in vision and headache that wouldn't go away. He's the one who really listened when she said that something just didn't feel right. When she had chest pains a few weeks after delivery, she's the one who insisted on admitting her to the hospital. Too many women die from pregnancy-related complications each year in the U.S. Death can occur during and up to a year after pregnancy. It doesn't have to be that way. Most deaths are preventable. Know the warning signs, hear her concerns. You could help save her life. Learn more at cdc.gov/hearher.
Now let's get into some statistics regarding especially Black maternal healthcare and mortality rates. According to statistics, the U.S. has the worst maternal mortality rates of any developed country, and those deaths are increasing. The U.S. has an annual rate of 17.4 maternal deaths per 100,000 live births. About 700 pregnant women die due to complications in childbirth each year. Black women are 3 times more likely to die from a pregnancy-related cause than white women. Multiple factors contribute to these disparities, such as variation in quality of healthcare, underlying chronic conditions, structural racism, and implicit bias. Preeclampsia, eclampsia, and embolism were the leading underlying causes of death among Black women. Postpartum cardiomyopathy, a disease of the heart muscle, and blood pressure disorders were the leading causes of maternal death in Black women, with the mortality rates 5 times higher than those for white women. Pregnant and postpartum Black women were 2 to 3 times more likely than white women to die of hemorrhage, severe bleeding, or embolisms, blood vessel blockages. Ectopic pregnancy was the 5th leading cause of maternal death for Black women, but was not a leading cause for white or Hispanic women. Late maternal deaths, those occurring between 6 weeks and 1 year postpartum, were 3.5 times more likely among Black women than white women, with Black women having 6 times higher risk than white women. And there is evidence that experiences of discrimination and racism have what they call a weathering effect on the body. In addition, chronic stress and trauma due to discrimination that occurs as early as in utero in early childhood, also known as adverse childhood experiences, have been associated with poor health outcomes and early death as an adult. Well, tonight, as I said, we're going to be talking with two experts, Angela Ramsey and Alexis Small. So let's start with Angela Ramsey. And Angela, why don't you tell us a little bit about yourself?
Yes. Hi, Brooke. So glad to be here this evening. Thank you so much to the women of Sigma Gamma Rho. I really appreciate being given this opportunity to speak with you guys about this very important topic. And so just to introduce myself, I am a registered nurse. I've been in the nursing field for over 25 years. I also have a master's degree in public health, whereby my focus is, restorative justice, looking at, structural systems of oppression related to all kind of healthcare issues for people of color. And I'm also a doula. I've been a doula now for about 8 years, and I actually have a private business related to being a doula, and it is called Tiny's Birthing House. It is in memory of my wonderful grandmother who birthed with my grandfather 16 beautiful children in the home setting with a lot of the traditions of her mother and her grandmother that were shared. And so this passion for birthing came for me after I had my first child. I am the mother of 4 children. I birthed all those children vaginally, and I'm just really excited to be here. And that kind of sums up who I am.
All right, Alexis.
Oops, sorry. Sorry, hold on.
Alexis is, can
Can
we
you
hear a
hear me?
little Aubrey?
Yes, that is my
Yes.
role. Let me try to
This is live, y'all. This is live.
That is my 1-year-old. My name is Alexis Small. I am an alum of Bennett College in Greensboro, North Carolina, where I studied journalism and media studies. And I am also the co-founder of Small World Social Media. So I bet you're wondering, like, how did I get into doula work? So I've always been passionate about watching women give birth. I started like watching around, I love the babies, thank you. Around high school, I was like, okay, I want to become a pediatrician. So I didn't really want to be in school that long. So I learned about doulas. And I recently became a doula this past October. And actually, I was doing doula work before I even knew that I was doing doula work. So one of my good friends had twins, and at the time, I was just understanding what postpartum depression was. She just gave birth to these twins. She just got married, and her life just changed. She went from no kids to having a family. She has twins, and then a year later, she had another son. She has a total of 3 boys, and she was just, explaining to me how she was feeling. She was going through different stuff, just depressed, trying to adjust to motherhood. And I just started going over and doing postpartum, post delivery work. And she just was so grateful that I would come over and wash dishes for her. Little small stuff that you don't think is a big deal. It could actually change, put a smile on someone's face. So, just encouraging her. Her hair started falling out, and it's like so much happens after birth. Even for me, I have a 1-year-old, which I stated, and after I had her, I remember, falling into like a slight depression, just needing help. And I wish that I had a doula during the time that I became a mom. And a few months later, I came across this doula program and signed up, and the rest is history. Just birth work it's life-changing and so heartwarming. And I, just want to help women around giving birth. There's so much, even that I experienced in the hospital when I gave birth to my baby, that I feel like was unfair treatment. And I just want to be able to be that person that helps other women when it comes to giving birth.
Thank you so much. Well, I guess the first question we need to ask is, what exactly is a doula, and what's the difference between a doula and a midwife? Either one answer
Yeah.
that, Angela?
Okay, sure. Yes. This is a question everyone always asks. They
Mhm.
always ask me, "What are you, a midwife?" I say, "No, I'm not a midwife." And so a doula actually originates from a Greek term. The word doula means um, it means a female nurturer or female servant, someone that actually will help during the time of birth. Now, think historically back in, the first century, second century, and what we'll see is that women had these large communities whereby when they had their menstrual cycles, they were in these large communities, kind of intense, if you will. They were intense. They were not to be engaging with the men. The women were kind of having their own community. And especially when a woman was pregnant, right around the time of birthing, there was always a female attendant that worked alongside of the birthing mom or the laboring mom. And this birthing attendant actually was the person that helped the mom throughout the time of pregnancy and after the pregnancy, just as Alexis was mentioning. And so we have doulas that work with you prior to delivery, during the whole 9 months of your pregnancy. And then there are doulas that are called postpartum doulas. And so essentially birthing attendants, birthing, workers. And our main focus is the mental health and wellness of mom. She talked about postpartum depression, and we're just there as a emotional support and providing any guidance that we can.
Thank you.
Yes.
So, Alexis kind of got into what led her to decide to become a doula. So I just wanted to ask, specifically, not to, kind of re-traumatize you or whatever, but you know, that part, during late October and you were taking these classes, what led up to that? And what exactly does that entail?
Okay, so I remember like around 2017, that's when I was first introduced to what a doula was, and I wanted to take the training, and I was unable to take the training for some reason. So I just put it in the back of my head, okay, I'm gonna become a doula one day. And then it popped up again after giving birth, and I was like, I need to become a doula. And it was just like, this is just something that I need to do. And it just landed in my lap. I came across this post on Facebook. If you want to become a doula, reach out to us, and we have a doula training for free. So I was like, okay, sign me up. So we did everything virtually. I met so many women, and I was actually trained by this lady. Her name on Instagram is the Black Doula, and she's in Atlanta. And she was so thorough, and she taught us so much. She was so patient, and I just, taking the class made me think I really needed a doula during my time in the hospital. I'll go into more detail of why. So I got to the hospital around 10 p.m. on a Monday night, and they made me wait a very long time. They, meaning the nurses, made me wait a very long time. I remember getting a COVID test. Like, who wants to have a COVID test when you're having these contractions? I understand how, important it is to know if I had COVID or not, but that's not really something that you want while trying to deliver a baby. And then they kept me in a room for a very long time, just to tell me, yeah, you are in labor, which I already knew. And luckily, when I got to the birthing room, the delivery room, there was a Black nurse, and I felt very, very safe. And she asked me, do you want to have this baby natural? Like, what is your birthing plan? And I said, I want to go natural, but if the pain is unbearable, I will get an epidural. And she was like, you're already doing a good job, because, women will already be asking for an epidural up front. They don't want to feel any pain. So that made me feel strong. I'm like, okay, I can handle this. And then she told me to stand up as long as I can while in labor, because once I lay down, gravity doesn't pull if you're laying down, but if you're upward, it will help the baby come down. And my body was dilating pretty fast, and as soon as I lay down, it's like everything just slowed down the process. I ended up getting the epidural. My back hasn't been the same since. I experienced hair loss, and my legs were very, very swollen. It took me days to like walk normal again. And then during my time in labor, they kept pushing a C-section out of nowhere. They just kept pushing it on me. And my mom was advocating, do not give her a C-section. Can you guys still hear me?
Oh, yeah.
Mhm.
Yes.
Okay, because it froze on my end. My mom had to advocate, so I guess she was like my doula. And they finally listened to my mom more so than me. And that's I felt like that's a little unfair. I'm the one that's having the baby. And a lot of women go through, the nurses not hearing them and not understanding. You got hello?
Yeah. Yeah. Gotcha.
Okay.
Thank you. Angela, so you're this professional, you have BSN, you have an MPH. What made you decide to be a doula? Was there
Yeah.
something you felt like a component was missing? So what was going on with that?
Yes, that's a great question. And I don't get to share this story a lot. And so I'm actually glad to share this story. And so when I was 17 years old, I had my first son. I am a teenage mom. And when I had my son at 17, didn't have a lot of support. It was something that wasn't obviously looked at, to be excited about. And I didn't have much support or the education from just a teenager standpoint. However, I will say that my mom, who is an RN, she actually connected me at the very last month. I went all the way to my, I think, 7th month without anybody knowing I was pregnant. It was a secret between me and my friends. At the 8th month, my parents found out, and my mom knew that I needed the education, knew that I needed the support, and she connected me with a teen pregnancy clinic at Kaiser Permanente, which is her employer, was her employer at the time. And I went through a program that took a cohort of about 15 to 20 teenage girls, and they had social workers available to us. They had college counselors available to us. They had job information for us. They had nutritional support for us. They had all kinds of support for us. And they helped us during this very traumatic part of our life. And for the most part, I went through that experience, and I really never thought much about it after that. I was raising my son. I had to, make sure that I educated myself. And that was mainly my focus as I was raising him. Educate yourself, provide for him, protect him. And then I had what I call my second set of kids. In my 30s, I was remarried and I had this new opportunity to look at birth through a different lens. And I couldn't help but remember all of the support that I had received from this teenage pregnancy clinic. I had, like I said, nutritionists. I had people telling me what I needed to eat, how often I needed to eat, preparing my body, how I needed to not just plan on having a baby, but there was preparation that was necessary and was needed. How to have your pelvis expand before the actual point of labor. And so when I had my second set of kids, I just heard about through one of my breastfeeding groups and one of the birthing groups that I had joined on Facebook, everybody was talking about a doula. And I said, what is a doula? I began to look up more information, and I immediately connected with a midwife in my community that also had doulas working with her. And my last 3 children were with the support of a midwife and or doula. And I got a chance to do some things that I was just finding out about, in my 30s, having children again. And I was able to labor with my last 3 children at home, in a tub with water. I was able to, have aromatherapy. I was able to prepare my body. There's, a lot of different things. My nutrition was, just where it needed to be. And based on those experiences with my last 3 children, I decided, you know what? I connect with this. I connect with birthing, even though I might not have wanted to connect with birthing, because I had a traumatic experience at the beginning, but I connected with it so much that I wanted to make sure that I can help other women and support them and their families, their partners, because partners are also essential to what doulas do. And so that's just kind of how I ended up having a passion and a heart for birthing.
Thank you. So next question, what are some resources expected mothers can access regarding doula services? And either one of you can answer.
Yes. Okay, so resources, there are multiple resources within the community. I do want to share a few resources. There are several birthing communities in Los Angeles in particular. There is the Hear Her campaign that is by the CDC. And within the hearhercampaign.org, within the CDC, they do have places where you can connect with either doulas or midwives. There are other resources within your health plans. A lot of your health plans, especially with the new Medicare reimbursement. I'm not sure if everybody is aware, but Medicare now reimburses and pays for doula services as long as the doula is licensed through the Doula Association of North America. It's called DONA. They will actually reimburse and pay for your doula services. And so those are just a few of the things that I would be able to recommend. So within your health plan, it's a very common topic now, doulas and midwives. Talk with your provider, your midwife. Then also hearher.org campaign is a campaign specifically for women of color that has been taken on by the CDC.
Oh, wow. So I think you kind of answered the question. Can it be covered by insurance? And you're saying that in some instances it can.
Yes, it can.
All right. So if you're unable to, what do doula services usually cost? What's the range?
Oh, yeah.
Like,
yeah, let's let Alexis go first.
yeah, Alexis. So yeah, how much do you charge, Alexis?
So I would say it depends on the doula. I know with the organization that I'm a part of, they start at 500 and it will go up. depending on what exactly you need done. Do you need overnight care? Do you need just laundry and a meal plan? It basically boils down to what exactly you want.
Okay.
Yeah. And then I would also spin off on that. It does have to do with what kind of doula. So there are birthing doulas, and then there are postpartum doulas. And so the birthing doula actually will follow you from the minute you find out you're pregnant all the way up to delivery of that baby in the birthing room. And then there are postpartum doulas that may not participate in that birthing part, and they may just do the postpartum. And then you may have someone who is just a broad spectrum doula and they do everything. And so the cost does vary. And related to the cost that I provide, I do it as like a whole service. If you actually want to work with me, or you want me to work with your family related to being a doula, I would be with you through the birthing process and in postpartum. And so my rates actually, because I'm an RN, my rates do start as low as $1,500 and go all the way up to $2,500. But that is with me staying with the family at the point where they find out that they're birthing. And I do a lot of other things that are kind of nursey. You know, I do blood pressure checks and all of those kind of things. I create a birthing plan and all of that. And then after postpartum, I do also visit, I go with the family to visit their physician, et cetera. So it just depends on what the doula does. Yeah.
Got you. So we're going to take some questions from our audience. So if you have a question for our panelist, you can just drop it in the chat. And so we're waiting. Anyone have any questions?
No, but can I share something related
Sure.
to birthing? One of the things that I do as a doula is I do provide pregnancy education. And so what that means is normally people will go to like a Lamaze class, or they'll go to some other class about birthing or breastfeeding, et cetera. And that is included in the services that I provide. And one of the things that I really want women to know that maybe they did not know is that when your body actually births a child, your body was created to birth babies. Okay. Having a baby is not a medical or a hospital or it's not something that you need intervention for. Okay. You don't need a lot of interventions if you're considered, you know, a healthy person, you know, just a person that doesn't have any complications. Now, I do know that there are some people who may have like pre-existing conditions, and maybe they need a little additional support. But for the average woman that is birthing, your body was created to birth. And one of the things that a lot of women don't realize is that when you actually go through those contractions and you have those pains and your pelvis widens and you actually push that baby through the vaginal canal, hormones released in your brain, and those hormones help you to bond with your baby. One of the alarming statistics that I've read throughout my time is that a lot of times, because of interventions like an epidural, because of other interventions that kind of block the receptors in the brain from a woman actually experiencing this love hormone of oxytocin, there is a disconnect, and it contributes to postpartum depression. And so a lot of times people are wondering, why is there so much postpartum depression? Why are we hearing about this so much more, lately? Well, a part of the reason is that women are not actually going through the actual, created birthing experience that they should have, which causes hormones to trigger in their brain, whereby allowing them to bond with their baby and bond with their spouse. That's another thing. A lot of women after birth, they usually hate their spouse, or not hate them, but the relationship is changed, right? And so in order for you to kind of understand why that happens, I just wanted to kind of bring that forward, that it happens because we are using so many medical interventions whereby blocking the way that our bodies were supposed to respond so that we can bond with our baby.
Oh, we do have a question from the chat. Do you recommend someone being a doula for their family member?
I'll take a stab at that. I don't see anything wrong with that. Well, it depends on what type of doula, because like postpartum doulas, my mom was my postpartum doula, and my sister as well, and they were a big help for me. Now birthing doulas, I don't know if I would want my mom to be the only one there to help me get my baby earthside, but postpartum, I feel like it's okay.
Yeah, I actually agree. I do think that your family should be your doula. I most definitely do. And I know, there's a little bit of, you want to maintain some privacy and you don't want them seeing everything. But I do actually find that it is very beneficial for women to have someone within their community that they consider family. Maybe it's not their family, but someone that they consider family, being there with them, advocating for them, nurturing them, providing compassion, providing that safe space, being their comforter. All of these things are needed and they're so necessary, especially for Black women. And why I say that is because Black women oftentimes are looked at by a lot of people within the community as being tough, being strong. Oh, you can handle it. Oh, you can take it. No, during this most important time of your life, you need that opportunity to be comforted, to be nurtured, to be treated with the utmost respect, because you're bringing forth, a new generation. And so I do agree. And one of the things that I do with my doula services is when I do provide the childbirth education, I invite not just the woman and her partner, but I tell them, invite as many people over your house as you want. I do this in their homes. I come to their home. I bring all of my, pelvis. I bring my, my infants. I show them everything. And I tell them, bring as many family members as you want to be there. And we're going to educate your whole family, because once I educate you all, then you can go with the next person and go with the next person, because we need to build these communities that support our families and our generations.
We do have another question from the chat. What are some of the different types of techniques that is provided besides just talking to the mother?
Oh.
There's birthing positions. There's also certain meals that you should be eating after you give birth to replenish the nutrients that your body just delivered. There's so much. Angela, can you?
Yeah, sure. Yeah. So there's a lot of techniques. I mean, I mentioned a few of them, but she's right. Nutritional support. A lot of times I go grocery.
Uh-oh. We have a freeze?
Yeah, I can still hear you guys.
Yeah. I think we have some technical. I think Angela is frozen. It's live, y'all. It's live. But I think Angela was saying that, she actually goes grocery shopping.
Hello?
Yes. We're back? Yeah, she actually goes grocery shopping for her
Oh, hello?
clients.
Hello?
Oh, I'm sorry. Did you guys lose me?
Yeah, we lost you.
God, I was just going on and on. I didn't even know. Okay.
Well, we
Let me
got to the
finish.
part where you were grocery shopping for your clients.
Yes. Okay. So grocery shopping for these for my clients, making sure that they have a meal plan, and then it goes even further than that. I do breathing. Talk to them about Lamaze and breathing techniques, the he ha, and finding their roar within that labor and that birth. I talk to them about the stages of labor because there are stages to labor, and if you can educate your mom to let her know that contraction is not going to last any longer than 1 minute, then your mom can get through each minute long contraction, and especially when it gets to the Latin phase of labor. And you can build up her confidence so she's not feeling like she needs the epidural and she's not feeling like she can't do that. So lots of education. Other things, aromatherapy is also something that we work with. I also work with the partner because the partner needs to also become comfortable enough to not just kind of stand, at the shoulder, kind of barely touching mom. Partner needs to be present. Partner needs to hold space. So we talk a lot about holding space and what that means. We also, we do the birthing plan, other technique. Positioning. We talk about pressure points, where the partner should put their pressure points on the back, and if there's back labor versus front side labor. So there are a lot of different things. It's actually really a wonderful service that is provided to women and their partners.
All right, we have another question. Can you recommend any program similar to the one that was mentioned earlier that supports teen moms?
Yes. Okay. I know one right off of the top of my head, but I can look on my Instagram really quick to find the other one, the name of it. But the one that I am going to be able to recommend is the one through Kaiser Permanente. Kaiser Permanente still has teen pregnancy clinics. There's one in Panorama City. There's one at Kaiser Cadillac, and there's also one at Kaiser Fontana. And so I actually was an administrator with Kaiser for 24 plus years. And so I'm very familiar with the Kaiser Permanente Teen Pregnancy Clinic. But I will provide you with one other resource. Just give me a few minutes and I'll find it for you.
All right.
While she's looking that up, I can give you guys some other resources for doulas. For the Villages is one. You can look them up on Google and Instagram. And there's the Black Doula. She's on Instagram. And Earth app, and it's spelled IRTH app. And they have everything you need. It's like a one-stop shop. They have services on breastfeeding. They're actually coming to Los Angeles really soon. They're based in New York, and they provide breastfeeding services, doula services. I want to say birthing classes as well. But it's a great, resourceful Instagram that you ladies should follow. And they also have a podcast too. If anybody's interested in listening to podcasts around birthing, let me double check to see what the podcast. I think it's called Your Birthright. That's what it's called, Your Birthright, and you can learn more about women and childbearing and everything doula.
Yes.
Let me ask.
I'm sorry. I did want to give a few resources. Oh, is that fine? Okay, yeah. So the Community Birth Center, is in Los Angeles. It is in the Culver City area. And her website is crimsonfig.com, and Crimson Fig Midwifery. She is a wonderful traditional midwife. And when I say traditional, that means that she is several generations of midwife, and she has doulas that work with her. And then also one that I'm very fond of is called Kindred Space LA. And Kindred Space LA has a wonderful pair of midwives that actually provide childbirth education. They have doula services, and they're amazing young women that work in the Los Angeles area.
Thank you. So I did want to kind of ask if there's been any evidence or research done to show health outcomes with women who have used doulas. Have there been more positive health impacts?
Yes.
I won't be bold enough to say less mortality, but what is
Yeah.
some of the evidence that's shown? Research.
Yeah, the evidence is showing a decrease in the cesarean rate. Cesarean section rate decreases when women have support, when they have the education, advocacy, support, confidence building. Like I told you, women don't know how to birth. No one teaches women how to birth. You just end up being pregnant and you're like, oh, we're having a baby. And you may, if you find time, go to a childbirth education class. But is it culturally competent? Is it going to honor who you are as a woman of color? Is it going to provide you and your partner with what is necessary? Most of the times, it will not. And so there is a direct correlation between birthing support for women through doulas and reducing the cesarean rate. Most definitely.
Okay.
I actually have a question for Miss Angela. I know that during my training, they touched on like nurses being a little standoffish when doulas are present. As a nurse and a doula, can you like walk us through that? Like, how do we, if say for instance, like I'm a birthing mom and I decide that I want to give birth, but I want to go to the hospital, but I want to bring my doula along.
Right.
How do I make everybody comfortable in the room,
Right.
including myself?
Yeah, that's actually a really good point. And so, yes, nurses are a little, they're a little protective of their patients, especially if they don't know much about what's going on. But what I will say is a lot of times what nurses want is that connection and collaboration right at the beginning. And so when I talk to, I don't know if I shared this with you guys, but I'm also a lecturer. I lecture at one of the post-secondary colleges for nurses, and I actually teach maternal child health and maternal child and pediatrics. And what I tell my students all the time is, if you're going to be working as the doula, the first thing that you want to do once you find mom's room and you locate mom and you check in with mom is you let mom know, let partner know, I'm going to step out of the room real quick and I'm going to connect with your nurse. Connect with the nurse at the beginning. Introduce yourself. Hi, my name is Angela. I'm the doula for Mrs. Johnson in room 215. I just wanted to share with you what we're planning on, doing to support her. I'm not going to do anything nursing. So nursing is all on you. I know I'm not a nurse. Nursing is all on you. But when it comes to her emotional support, when it comes to her comfort, when it comes to finding ways to reduce her pain, that is why I'm here. And so I just wanted to let you know that, I'm not here to get in your way. I am here to support Mrs. Johnson. And, I'm looking forward to, working with you to help her deliver this baby or get this baby, born. And so I find that a lot of doulas are not comfortable with that type of conversation. And so what I would instruct or encourage someone to do is find a comfort level where you can approach the nurse knowing that you are qualified for what it is that you're going to be doing, more than qualified to help comfort and provide support to this mom as she's laboring. Whether that's a back rub that the nurse doesn't have time to do, you're available to do that. And so it's just kind of partnering with the nurse, being able to have that conversation. And usually after you've done that, the nurses are usually okay with that.
Okay.
Thank you.
So we're just going to take the last couple of minutes just for a last word on our panelist. So what do you want to leave us with, Alexis?
Hmm. I would say this. The birthing conversation can get very emotional depending on what type of experience that you have had. Um, I would say it is it is a lot of women are dying, and when it comes to giving birth, I would strongly suggest that you get a doula and get as much education prior to birthing as possible, and you won't regret it. Knowledge is power, and if there's any women that are expecting right now, just know that your body is capable of doing what it needs to do. um,
Mhm.
if the if you go to the hospital and they're pushing a C-section on you, just know
Mhm.
that your body can do what your body was created to create. So you're able of getting your baby here, earth side, sorry, and you're capable of doing it. You just have to believe in yourself and mentally prepare, um, and understand, like, what you're about to go through. And I'm rooting for you guys, and I'm very grateful to be here to speak about this. I'm very passionate about uh, Black women and Black women birthing. So thank you for having me.
Thank you. Angela?
Yes. So if I could, leave, um, the viewers with anything, it would be two separate categories of things. The first thing is related to what do I feel, and what does the research say that is going to help reduce the mortality rate with women of color. And so those things include things like health literacy, making sure that people know how to care for their body, knowing what signs and symptoms are um, adverse, that if they're having headaches, if they're having vision changes, if their feet are swelling and their hands are swelling, if the ring is too tight, as the pregnancy goes on, if these different things are happening, women need to know that these are not normal pregnancy symptoms that happen, but these are things that they should be reporting to their physician, their midwife, in order for them to actually manage whatever the underlying cause is. The other thing is, we need to have appropriate action when it comes to Black women. We need to listen. We need to hear them. As a healthcare provider myself, I am always advocating for listening to your patient, listening to what it is that they need. I instruct my students all the time, whatever the patient says, that's what it is. And you need to take appropriate action. You need to be responsive to the care that this patient needs. The other thing would be equity and access to things like a doula. Black women should have access to doulas. Black women should have access to midwives, and it should be a part of their health insurance and their health coverage. And like I said before, there was a new law that was passed last year related to Medicaid. Medicaid reimbursement for doula services. And then the other thing that I want to just speak on is that when it comes to um, birthing, women of color, and women of color need to understand that you were made to birth with a community of women surrounding you. You were created to birth with a family or a unit of people. And I know that in today's society, maybe you don't have, the family that you want, but you can pick your family. Find people around you that, would support you and can be there for you. And you need to be surrounded by the knowledge and information that they have. And we need to support one another. We need to support our families, and I think birthing is completely amazing. And like Alexis said, we don't have to try to figure out birthing. Our bodies are already created to birth. And we just need to be aware of any complications that may come up and really speak forward and do not back down until we are heard. And so that's
Thank
pretty much
you.
it. Yeah.
Right. And one last thing, there is some information about a project that our soror is doing. And here it is right here. If you'd like to share a story and be a part of a documentary on Black maternal mortality, please visit the link below. And it's thedavisplan.com, me and Nita Doc. So once again, I'd like to thank our panelists for joining us tonight. Thank you all so much for your time, your information. Angela, Alexis, I personally have learned a whole lot. For someone who really didn't know just between a doula and a midwife and a nurse, this has just been highly educational. Thank you so much for joining us. And I hope our viewers out there, they learned something. And if there's anything else that you would like to learn, you can definitely visit the links that we provided. Angela and Alexis are also on social media. So if there are any questions that you want to ask them, they do have their information that we provided. We can provide it once again. And once again, thank you for joining us. Take care. Have a good evening.
Bye. Thank you.
Bye
Guys.
bye.
Night.
Bye.
Thank you for joining us. Please feel free to visit us on the web at www.sgroyalculvercity.com. You can also find us on Facebook, Instagram, and Twitter at SG Culver City, as well as on YouTube at SG Culver City. Thank you for another episode of RHOyal Table Talk.